I work with digital solutions for real-world problems. Whenever I try to come up with a new solution, I make a mind map. It can look something like this. When I'm done with the mind map, I try to explain it for a coworker or a friend who volunteers. Last time I did so was for my office mate, who just happened to be in the room. She responded with one single sentence. She said, "It's a bit messy, but interesting." And I thought that was a funny reaction, because it was, in fact, very messy. But also, isn't that just life in general? We try to make all these plans and strategies for our futures, but there is no way of knowing what will happen when we grow old. About a year ago, I was on my way to my niece's first birthday party. On our way there, my grandma called, and she needed help. I have always pictured my grandma something like this. At that point, she was 93 years old. She had survived both strokes, blood clogging, broken arms, and a lot of other things, but she had never been scared once. But this time she was scared. So we realized it was an emergency, and we rushed to her house. When we got there, she was barely conscious, and she was in a critical condition. So we called for an ambulance, which took her to the hospital, where she stayed for 4 weeks. But after the first week, she got put into a low intensive care unit because she was better, at least a little bit. But when we came and visited her, which we did almost every day, we realized something was strange. She had gotten an infection in her body that had altered both her memories and her cognitive skills. So every day we came, it was different. Some days she wouldn't recognize it as all. We needed to convince her that we were her relatives. We needed to explain to her why she needed to eat and stuff like that. While other days, she was just as she has always been. She could talk about memories from the past very vividly, and she could understand whatever we tried to explain for her. And I was curious about this, because how would the doctors treat that? I had never seen this before. I had only seen diseases where you gradually became worse and worse until you got treatment, and then you became better and better until you were healthy again. What they did was that they treated her as if she was in the worst case scenario at all times. They helped her with everything. And those days when she needed the help, when she didn't remember stuff, she was very happy and grateful for all that help. But those other days, she became frustrated, and she asked them, "I'm 93 years old, don't you think I can eat by myself?" And of course that was a bit funny, but also you can imagine how it felt for her. But the doctors helped her gladly anyways, of course. But what they also did was that they measured her heart rate, blood pressure, and temperature in order to kind of proactively diagnose what would happen next. They tried to find patterns in her health in order to see when she was healthy enough to come home. And after 3 more weeks, she was healthy enough to go back home, but there waited home care. She got caregivers who came by her house several times a day, and they helped her with the most basic stuff, like cooking and cleaning and all of that. And again, the same pattern occurred. Those days when she needed the help, she was super grateful for it. And those other days, again, asked why. Why would I need help eating or cleaning and so on? I've been doing this for 93 years old. So don't you think I can do this by myself? And I thought, could we solve this in some way? Making sure that the personnel knew in which kind of state the patient was in before they even got there. We know that it's very easy today to collect information such as heart rate and blood pressure and temperature on its own with just sensors that you put on the body, like in a smartwatch or something like that. But then, to do this proactive diagnosis, well, it was all about patterns, basically. You need to think further. But luckily, artificial intelligence has gone so far that machine learning is something that we can utilize today. It's both time efficient and resource efficient. And again, it is all about patterns. So that's very convenient, right? It is utilizing what we know about the past in order to try to predict the future, or just trying to classify what has happened before. So what if we could make a digitally assisted home care in the future? In that way, not only would the caregivers know what to expect when they came home to a patient, but also they would know if they would need more help than usual. They could tell already in the morning that this patient will need the same help as usual, or maybe something will happen today, maybe be on alert for more. Because those days when my grandmother was healthy and felt that she could do things by herself, she still wanted the company, but she just wanted the company. She wanted them to socialize and be with her. And also, she doesn't want to ask for help. She wants them to know when she needs the help, if she would need help. And about a week ago, she fell, and she couldn't get up. And although she has this little button on her wrist, which she can press to get help immediately, she didn't want to press it because she didn't want to be a burden. So again, it would be amazing if we could know when these things happen, and then send help when it's needed, and act as if it was just in routine. And I got very curious about this, wondering, are there other diseases that are fluctuating like this, back and forth, back and forth? And what I got to know was that we have never had such an old population ever before. That is because healthcare is evolving very fast, but our bodies are not evolving as fast. This leads to a lot of age-induced illnesses, and a group of those are called dementia. And this is, again, affecting memory and cognitive skills, and it's fluctuating back and forth. So some days the patient might act as if they were completely healthy because they feel healthy. But those other days, they might have trouble remembering who they are and how to do the basic tasks again. And just as with my grandmother, you usually treat this as if it was the worst case scenario at all times. When you get diagnosed with it, you get your driver's license revoked. You're also told that it might be a good idea to stay indoors, except if you have someone to accompany you. And if I got to hear that, I would feel that was very deliberating. That could lead to isolation of these elderly people, and that leads to depression, which leads to an even faster progression of these symptoms, which is very, very bad. But the more I read about this, the more I understood about it, because there is this critical condition that occurs, which is called elopement. That is when a patient basically shuts down the active part of their brain without knowing about it. They might be eating or tying their shoes or whatever, and there are no visual clues to when this is about to occur. And what happens is that the patient wanders off, and they can go a long way. They can walk for kilometers until they become aware of their surroundings again. And when they do, it's very scary, not only for them but also for the relatives, because they won't know where they are, how they got there, or how to get back. But maybe we could look into the biometrical data again, looking at the heart rate and blood pressure. Because what if we could use the past to predict the future and see when this is about to occur? That way we would know when it's safe for them to go outside by themselves and when they would need help. And also adding, for example, positional data, we could be able to track their movements and also know if this is happening, we would know where they are, so we could send help. Not only that, but if we aggregate this data, we could help even more people. There is another theory that says that elopement occurs because of external stimuli. Stimuli like, for example, spatial configurations in the built environment, how you have planned different roads and squares in the town and so on. If we were to have this aggregated data, perhaps we could find these places that have a lot of troubles. In that way we could alter them and make them better. And then we go from just helping the patient into working with accessibility for everyone. Because we will get to know what parts are not working in our society right now, at least planning-wise. You might be thinking that this all sounds really, really good. And if we can help others while helping this very specific user group, that would be amazing. But how would you collect all of this information and all of this data? I mean, my grandma doesn't even know how to turn on her DVD player. How would she be able to collect her heart rate, blood pressure, and temperature, and all of that, and trying to analyze all of that? And that's a really good question. But luckily, today, it's very popular to use something called implicit interaction. And what that means is that you're just doing your life just as you would, because remember, we are trying to give more freedom to the patients. They could do whatever they usually do, and all of these things would happen in the background. An example of this is, for example, when you walk into a room and the lights turn on by themselves. You were already going to turn on the lights anyway, but they did it for you. That is implicit interaction. Or in your smartphone, for example, you usually have a step counter. You don't turn it on by yourself. It just turns on when you start walking, and it counts every step for you. You don't have to do anything actively. That, again, is implicit interaction. So what if we could use all of this knowledge that we've been talking about now, and all of these theories and visions for the future? Maybe we could then create a network. A network with the patient in the middle, who can have more freedom, but also contributing to helping itself and those around them by collecting information about their vitals, like heart rates, submitting it all through some mobile device like a smartwatch or smartphone to a database where it's analyzed by machine learning algorithms. Again, on an individual level, their doctors and caregivers will know more about the patient and how to treat them, but also on an aggregated level, researchers will get to know more about the progression of symptoms of dementia and other diseases, and decision makers and city planners will know more about how to make an accessible city in the future. So the point I'm trying to make here is that if we refocus and start thinking with modern technologies how to save the elderly, not only will we make their lives a little bit less messy, more interesting, and giving them more freedom, but we will also make the future of our society better at large. Thank you.